Magnesium supplements. 3 do and 3 don't you must know. Magnesium can help, but you need a clear plan. In this video, we talk about magnesium supplements in a calm way. Many adults do not meet daily needs, and some run into magnesium side effects because they guess on dose or timing. I will give you a simple 3 do and 3 don't guide. You will hear what elemental magnesium on a label means, and why staying under the UL 350 milligrams per day from supplements matters. We will touch on when magnesium for sleep, magnesium for cramps, and magnesium for blood pressure may help, without overpromising. I will also show you key magnesium interactions, and who should not take magnesium, including CKD magnesium risk, PPI hypomagnesemia, and a digoxin magnesium interaction timing tip to protect your treatment plan. My goal is clear: give you safe steps you can use today, and help you talk with your clinician if you have conditions or prescriptions. Stay because the first rule shows how to start safely and avoid stomach issues while you build results. Disclaimer: this video is educational and not medical advice. Do not start, stop, or change magnesium supplements without talking to your doctor, especially if you use prescription medicines, have kidney or heart conditions, diabetes, or are pregnant or nursing. If you feel unwell after a supplement, seek urgent medical care immediately. Magnesium supports energy, nerves, muscles, and heartbeat. Many adults fall short, so magnesium supplements can help when used correctly. Possible benefits include improved sleep, reduced leg cramps, and minor pressure changes. Dose and timing matter. If magnesium helps, why can it still put you at risk? Stay for do number 1 to see a safe start that avoids stomach issues and protects your meds. Do number 1. Start low, track response, respect elemental dose. Here is how to begin magnesium supplements safely so you can feel the benefits without trouble. Read the label for elemental magnesium and base your dose on that. Begin with 100 milligrams at night with food for 1 week. If tolerated, move to 200 milligrams per day, split morning and evening, and watch for magnesium side effects like loose stools. Stay under the UL of 350 milligrams per day from supplements unless your clinician advises otherwise. The NIH lists this limit and notes common gastrointestinal effects. Potential benefits are modest. Meta-analyses show small average drops in magnesium for blood pressure, and a randomized trial in older adults improved sleep scores, so a steady evening dose can be tested for magnesium for sleep. Forms matter in studies comparing citrate with oxide, which show higher bioavailability for citrate. Therefore, choose a well-tolerated form. Keep a 2-week log: dose, time, food, sleep, cramps, and any bowel changes. If night cramps are your issue, look for fewer spasms over 2 weeks. If none, pause and review with your clinician. Space magnesium from antibiotics, bisphosphonates, and levothyroxine by 2 hours, and ask about heart medicines to avoid a digoxin magnesium interaction. Do not self-start if you have kidney disease due to CKD magnesium risk. Next up, you will see when to take it, what food helps, and how to avoid clashes with other pills, so absorption stays on your side. Do number 2. Choose forms and timing that fit your goal. Choosing the right form and timing matters because guessing can waste money and limit results. Think about the goal first. For daily use, many people tolerate magnesium glycinate better than magnesium oxide. However, magnesium oxide can be useful when constipation is the primary issue, but it is less ideal for routine nutrition. Some also do well with magnesium malate for daytime use. Take magnesium supplements with a meal if you want fewer stomach issues, and split small amounts morning and evening to improve comfort. If your goal is magnesium for sleep, keep the larger portion in the evening and keep the time the same each night. Always look for elemental magnesium on the label so you know the true amount, not just the tablet weight. If you use heart medication, ask your pharmacist about the digoxin magnesium interaction and agree on a safe timing. Hold a short note in your phone with dose and timing so the plan stays clear when you travel or change meals. This approach protects absorption and keeps side effects lower without making your routine complicated. Keep watching, because the next part matches magnesium to common life situations, including older age, training, stress and diabetes, and magnesium blood sugar concerns. Daily consistency makes results clear. You can fit magnesium supplements into daily life with a few careful choices on form, food timing, and spacing. Do number 3. Match magnesium to risks, goals, and monitoring. Match your magnesium supplements to your situation, not a generic plan. Some groups need closer attention: older adults, people who sweat a lot from work or exercise, and anyone under high stress. If you live with diabetes, remember the link between diabetes and magnesium. Low status can make glucose control harder, so set a safe plan with your clinician. Research shows small average changes for magnesium for blood pressure. Use magnesium to support care, not to replace it. Choose well-tolerated forms for daily use, such as magnesium glycinate, magnesium citrate, or magnesium malate. Check the label for elemental magnesium and keep supplemental intake at or below the UL 350 mg per day, unless your clinician advises otherwise. Make a simple 3-month review. Write your goals: sleep, cramps, training recovery, your dose, any new medicines, and how you feel. Add a quick check for magnesium deficiency signs such as night cramps, eyelid twitching, poor sleep, or unusual fatigue. One blood test can miss problems, so pair symptoms and risks with professional advice. If prescriptions change, recheck timing for magnesium interactions so pills do not compete. Keep adjustments small and test one change for 2 weeks before judging. If a goal improves, hold the dose. If not, revisit the plan. Here is the safety hook. Some people should pause or skip supplements and get medical guidance first, including those with chronic kidney disease, very low blood pressure, or slow heart rhythm. Up next, the first don't explains why kidney problems and slow heart rhythms can turn a simple pill into a serious issue. Don't number 1. Skip magnesium if you have kidney disease or conduction issues unless cleared. Some people should not take magnesium supplements unless a clinician approves the plan first. If you have chronic kidney disease, the CKD magnesium risk is real because damaged kidneys clear magnesium slowly. Levels can rise and cause weakness, nausea, low blood pressure, and serious rhythm problems. People with very low blood pressure should be careful. Magnesium can drop it further and trigger dizziness or fainting. If you have electrical issues in the heart, such as bradycardia or heart block, magnesium can slow conduction more and worsen symptoms. These risks mean you need a medical review first. Tell your doctor about all conditions and pills. Ask if it is safe and if labs are needed. On dialysis or with acute kidney issues. Do not self-start. If medicines already lower pressure or slow the heart, magnesium may amplify that. Also, who should not take magnesium includes recent unexplained fainting, unstable rhythm, or chest pain under evaluation. When safety is unclear, pause and get guidance first. For everyone else, next we cover timing and spacing, so plans work smoothly. Stay with me because the next section shows the exact timing gaps that prevent common magnesium interactions with everyday medicines. Avoid magnesium antacids or laxatives unless cleared. They can deliver large amounts fast in kidney disease. Watch for high magnesium signs: muscle weakness, flushing, heavy sleepiness, slow reflexes, or worsening low pressure. Seek care if these appear. If you have device-detected arrhythmias or wear a monitor, wait for results and guidance before starting any supplement. Don't number 2. Do not mix magnesium poorly with key medicines. Here's the real issue. People often take magnesium supplements at the same time as other pills, and minerals in magnesium can block or change how some medicines work. To keep things simple, use one rule for the common clashes. Keep at least a 2-hour gap between magnesium and the other drug, unless your doctor tells you a longer gap. Longer gaps are fine if advised. This helps with tetracycline and fluoroquinolone antibiotics, because magnesium can bind to them and lower absorption. The same spacing helps with bisphosphonates used for bones and with levothyroxine for thyroid. Both can lose strength if taken together with magnesium. If you use long-term PPIs for heartburn, know that they can cause low magnesium over time, PPI hypomagnesemia. If you must stay on a PPI, ask your clinician about checking levels and adding food sources of magnesium. If levels stay low, your doctor may adjust the PPI plan. Some diuretics increase magnesium loss in urine, so review your lab results and supplement plan with your doctor to avoid a slow drop. If you take digoxin, do not stack it right next to magnesium. The digoxin-magnesium interaction can change absorption and affect your heart treatment, so coordinate exact timing with your pharmacy team. Keep a simple note on your phone with your pill times, and keep using that 2-hour spacing rule to avoid confusion. Right after this, you will see which forms to avoid for daily use and how to prevent stomach upset without giving up. Don't number 3. Avoid poor forms for daily nutrition and big empty stomach doses. Use this final safety rule to keep your plan steady. For routine support, avoid relying on magnesium oxide as your main source. Human absorption studies report lower fractional uptake from oxide, while citrate and bisglycinate forms raise blood and urinary magnesium more. Clinical references also note that supplemental salts are a common cause of loose stools at higher intakes. That is why people use magnesium glycinate or magnesium malate for daily use and reserve magnesium oxide for a laxative role when a clinician agrees. Keep each serving modest. Check the label for elemental magnesium and aim for small portions, 100 to 200 milligrams per serving. Then space them across the day with meals. Food improves comfort and helps you stay consistent, and skipping food can make magnesium side effects more likely. Nora, 67, switched from 400 milligrams magnesium oxide daily to 100 milligrams magnesium glycinate with dinner for a week, then 100 milligrams morning. Her bowel pattern normalized and night calf cramps eased by week 2, so she kept the lower, split plan. Practical checks. If stools loosen, reduce the last increase or move part of the dose to another meal. If discomfort continues, change form and retest for 2 weeks. Keep total supplemental intake within your plan and talk to a clinician if you use other medicines or have kidney or heart issues. Stay with me for a brief study recap, straight to the point and easy to verify. Here are the study-backed points in simple terms. The NIH Office of Dietary Supplements sets the adult supplemental limit at UL 350 milligrams per day for magnesium supplements, explains that labels list elemental magnesium, and gives timing gaps to reduce magnesium interactions with antibiotics and bisphosphonates. It also notes that less than 1% of body magnesium is in serum, so symptoms and risks matter when you review status. Meta-analyses of randomized trials, including work in hypertension, show small average reductions with magnesium for blood pressure of roughly 2 to 3 millimeters of mercury. Trials in magnesium research and the Journal of the American Heart Association find magnesium citrate more bioavailable than magnesium oxide. The US FDA warns that long-term PPIs can cause PPI hypomagnesemia. Separate levothyroxine from magnesium to protect absorption and coordinate timing if you use digoxin. Before we finish, one reminder. Do not self-medicate with magnesium supplements. If you have kidney disease, the CKD magnesium risk is serious. Only use them with clinician's approval. If you have low blood pressure, slow heart rhythm, or several prescriptions, ask first. Your safe plan is simple. Base your dose on elemental magnesium, keep a steady routine, and leave timing gaps to avoid magnesium interactions. Choose forms you tolerate and stop if side effects appear. Set one goal, such as magnesium for sleep, magnesium for cramps, or magnesium for blood pressure, then review results after 2 weeks. If you are unsure at any point, pause and call your care team. Comment your goal below and tell me your age group and if you take prescription meds so I can tailor safety tips in replies. Suggest the next topic you want covered. Please like, share with a friend, subscribe, and turn on the notification bell to get new videos.